Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on coagulation pathways and clotting disorders, each with 4 answer choices and detailed explanations. Vignette 1, Hemophilia A. A 7-year-old boy presents with recurrent hemarthrosis and prolonged but a normal PT. There is a family history of bleeding disorders in male relatives. What is the most likely diagnosis? A. Hemophilia A. B. Hemophilia B/C, von Willebrand disease. D. Factor V Leiden. Answer A. Hemophilia A. Explanation: Hemophilia A is an X-linked disorder due to Factor VIII deficiency, leading to prolonged aPTT with normal PT. It presents with hemarthrosis, deep muscle bleeds, and easy bruising. Treatment: Factor VIII replacement. Vignette 2, Hemophilia B Christmas disease. A 10-year-old boy has spontaneous joint bleeding. Labs show prolonged aPTT, normal PT, and low factor IX levels. What is the best treatment? A. Desmopressin, DDAVP. B. Factor IX replacement. C. Fresh frozen plasma. D. Vitamin K. Answer: Factor IX replacement. Explanation: Hemophilia B is caused by factor deficiency and is managed with Factor IX replacement therapy. Desmopressin, DDAP, is used for mild Hemophilia A but is ineffective in Hemophilia B. Vignette 3, von Willebrand disease, VWD. A 16-year-old girl presents with heavy menstrual bleeding and frequent nosebleeds. Labs show prolonged bleeding time, normal PT, and slightly prolonged aPTT. What is the best treatment? A. Factor VIII replacement. B. Desmopressin, DDAP. C. Vitamin K. D. Heparin. Answer: B. Desmopressin VWD is the most common inherited bleeding disorder caused by von Willebrand factor VWF deficiency, leading to platelet dysfunction and mild Factor VIII deficiency. Desmopressin, DDAVP, increases VWF release from endothelial cells. Vignette 4, Factor V Leiden thrombophilia. A 35-year-old woman on oral contraceptives develops a DVT. Genetic testing reveals a Factor V Leiden mutation. What is the pathophysiology of this disorder? A. Deficiency of protein C. B. Resistance to protein C degradation. C. Antithrombin 3 deficiency. D. Deficiency of Factor VIII. Answer: Resistance to protein C degradation. Explanation: Factor V Leiden mutation makes Factor V resistant to protein C inactivation, increasing the risk of DVTs in Ps. It is the most common inherited hypercoagulable disorder. Vignette 5, Antithrombin 3 deficiency. A 28-year-old woman develops recurrent DVTs despite being on heparin therapy. What is the most likely cause? A. Protein C deficiency. B. Factor V Leiden mutation. C. Antithrombin 3 deficiency. D. Vitamin K deficiency. Answer: C. Antithrombin 3 deficiency. Explanation: Antithrombin 3 deficiency leads to heparin resistance, as heparin requires antithrombin to inactivate thrombin and factor XA. Patients need higher doses of heparin or alternative anticoagulants. Vignette 6. Protein C deficiency. A 29-year-old man develops skin necrosis after starting warfarin. What is the most likely underlying disorder? A. Factor V Leiden. B. Protein C deficiency. C. Hemophilia A. D. Von Willebrand disease. Answer: Protein C deficiency. Explanation: Protein C deficiency leads to excessive clotting and warfarin-induced skin necrosis, as warfarin initially lowers protein C levels faster than clotting factors, causing a transient hypercoagulable state. Vignette 7, Disseminated intravascular coagulation. A 35-year-old woman with sepsis develops oozing from IV sites, bruising, and hypotension. Labs show prolonged PT, prolonged aPTT, thrombocytopenia, and elevate is the best next step. A. Heparin therapy. B. Platelet transfusion. C. Fresh frozen plasma plus supportive care. D. Desmopressin. Answer: C. Fresh frozen plasma plus supportive care. Explanation: is a consumptive coagulopathy triggered by sepsis, trauma, or malignancy, leading to widespread clotting and bleeding. Treatment focuses on correcting the underlying cause and replacing depleted clotting factors. Vignette 8. Heparin-induced thrombocytopenia, aPTT. A 50-year-old man on heparin therapy for a DVT develops new thrombosis and a platelet kit count drop from 200,000 to 80,000. What is the next best step? A. Stop heparin and start warfarin. B. Stop heparin and switch to a direct thrombin inhibitor. C. Give platelet transfusion. D. Start aspirin. Stop heparin and switch to a direct thrombin inhibitor. Explanation: HIT is a prothrombotic disorder caused by antibodies against platelet factor IV heparin complexes. Management: stop heparin and start a non-heparin anticoagulant, e.g. argatroban or bivalirudin. Warfarin should be avoided initially. Vignette 9. Warfarin-induced coagulopathy. A 72-year-old man on warfarin presents with elevated INR and spontaneous bleeding. What is the best immediate treatment? A. Fresh frozen plasma and vitamin KB. Platelet transfusion. C. Heparin infusion. D. Desmopressin. Answer: fresh frozen plasma and vitamin K. Explanation: warfarin inhibits vitamin K-dependent clotting factors, 2,7-IX. In cases of severe bleeding, reversal is achieved with fresh frozen plasma for immediate effect and vitamin K for sustained reversal. Vignette 10. Vitamin K deficiency. A 65-year-old man with liver cirrhosis presents with bleeding gums and prolonged PT but normal platelets. What is the most likely diagnosis? A. Hemophilia A, B. Factor V Leiden, C. Vitamin K deficiency, antithrombin 3 deficiency. Answer C. Vitamin K deficiency. Vitamin K deficiency leads to reduced production of factors 2,7-IX, causing prolonged PT-INR with normal platelets. It is common in liver disease, malabsorption, and prolonged antibiotic use.